Welcome to today's episode of Ignite Health, brought to you in partnership with Caribbean Surgery Incorporated. This program is dedicated to empowering you with trusted medical information, expert insight, and practical advice to help you take control of your health. I am Dr. Surendra Persaud, the Medical Director at Caribbean Surgery, and your host for today's episode. Each week, we break down important health topics, answer common questions, and help you understand when and why it's time to seek medical care. Because informed choices that you make today can lead to healthier lives tomorrow. In this episode, we're going to talk about head and neck cancers. Now, that's a very large group of disease processes, but it's a group of diseases that are becoming more common in our region. And so in Guyana and across the Caribbean, sadly, these are often diagnosed too late. What are head and neck cancers? We all know where the head and the neck is, but let's review that a bit. So we're talking about head and neck cancers which affect the tissues in the mouth, the tissues in the throat, the tissues in our voice box, the tissues in our nose and sinuses, the salivary glands, our thyroid gland, and of course, all of us have felt a swollen lymph node or another in our neck, so we have lots of lymph nodes. Now, these areas, they control very important things. They control our speech, they control our breathing, they control our swallowing, how we look, and this is why early diagnosis is very, very important. Medically, we need to discuss what is the neck. We all take our neck sort of almost for granted. We don't realize how busy and how critical this area of our body is. Let's list, for example, the medical terms. And these medical terms are quite complex, and then we'll come back over those medical terms and discuss what they are the more simpler terms. So what happens when we talk about the voice box? Well, that's our larynx. When we all say our throat, in medicine we call that our pharynx. Everybody knows about the thyroid gland. What about the esophagus? The esophagus is part of our neck. And the esophagus is very important. Everything we eat and everything we drink has to take the esophagus, has to carry it. It's that tube that takes it from our mouth into our stomach. How are we doing breathing, right? Respiration, we have to inhale the air and exhale. And that has to go through the trachea or the so-called windpipe. And all of that is also in the neck. Every one of us has had an infection in our neck or face at some point in time. All of us have felt an enlarged lymph node. And the neck has a significant amount of lymph nodes. Then what about the blood vessels? The carotid arteries, the jugular veins, all of these very, very important vessels. And so the neck has a lot of very important structures in a relatively small space. And this is actually one of the most significant challenges when we deal with diseases of the neck or diseases of cancers of the neck. In addition to all of the blood vessels and all of these structures, it's got to have nerves. Just think about it. All of the nerves that are involved in us being able to speak, all of the nerves that are involved in our ability to swallow. And so in this very small space we call the head and the neck, we've got a tremendous number of important organs. So just to summarize that, we've got our throat, we've got our voice box, we've got our thyroid gland, the esophagus, trachea, lymph nodes, major blood vessels, and then all the nerves that control that. Now, why is it that cancers of the neck will spread very, very quickly? As we've mentioned, it's a small space, lots of very important organs, and if it's a small space and lots of very important organs, then they're not going to be far from each other. They're going to be relatively close. And so this battery of lymph nodes, this large amount of lymph nodes we have, are where these cancers will spread to. Remember, as we've said, the lymph nodes are our guards. They are where everything that goes on drains into these lymph nodes. So if you have an infection, the infectious particles will drain and the lymph nodes will trap them. If you have cancers and they spread, they will get trapped in the lymph nodes. And so Because this is very small spaces and everything is close together, the cancers have a greater opportunity to spread within these vital organs. Now, there's a little bit of good news because this being such a small space, being at an area we are looking at all the time, you should be able to feel or see a lump in the neck very quickly. So any lump in the neck that you see, and it's there, 1 week past, 2 weeks past, 3 weeks past, and that lump is not going away, you really need to go and see your doctor. Now, because of all of these organs or these parts of the neck, when we as doctors think about the neck, we can't think about the whole head and neck as one area. We have to divide it into its various parts. So, for example, what we commonly speak about as the mouth is considered the oral cavity in medicine. Then there's the back of the mouth, which we call the oropharynx. Then there's the nasopharynx, which is essentially the area of our head and neck that's behind the nose. Then the hypopharynx, which is the lower portion of the throat. The larynx is our voice box. And then we have our sinuses. We have multiple sinuses in our face, and then we have our nasal cavity. And then most importantly also, we have our salivary glands, without which we don't produce saliva, makes it more difficult for us to consume food. Then right in the front here, we have a thyroid gland. The thyroid gland, as many of us know, produces hormones that help us control a lot of the metabolic activities in our life. And so the thyroid gland can also develop a cancer. And these are how we have sort of divided the whole body. So let's talk about the oral cancers. And the oral cancers will affect specific parts of the body. It'll affect the tongue, it'll affect the gums, it'll affect the lining of your cheeks, it'll affect the floor of the mouth, and then the palate, which is essentially the hard palate, which is the roof of the mouth. And the common signs of an oral cancer will be an ulcer that is persisting in the mouth. 2 weeks past, 3 weeks past, that ulcer isn't healing. You have pain, you have bleeding. It's difficult to chew, difficult to swallow. Now, what about throat cancers? So this is where you're talking about cancers of the oropharynx. That's the tonsils and the back of the tongue. You're talking about the nasopharynx. This is the area behind the nose. You're talking about the hypopharynx. This is the lower throat. And because of these areas that are affected, you're going to have a persistent sore throat. You're going to have difficulty swallowing. You're going to have ear pain. You're going to have neck pain. Because the nerves at the back of the throat, all of us who have had a sore throat, or we will wonder sometimes why we have an ear pain, and it's because these organs are connected in one way or the other. Human papillomavirus. We have had a long conversation. We have learned so much about human papillomavirus, and we spoke about it as it related to certain cancers, such as cervical cancer, penile cancer, anal cancers. We now know that human papillomavirus is a causative agent in certain types of cancers of the tonsil and the throat. Now, these type of cancers will occur in non-smokers, and that's very, very important for our audience to understand. These are cancers because they're HPV related that are not occurring in smokers. It's occurring in younger adults who have been exposed to human papillomavirus. And because we now have human papillomavirus vaccination, this disease is essentially preventable. Now, what about voice box cancers or cancers of the larynx? Now, again, this is hoarseness. In order for us to speak, our vocal cords have to move. So if you're having a swelling there, if you're having a growth there, it's going to interfere with our ability to speak. So a hoarseness that lasts for more than 3 weeks. And I've known a few patients who this was the only time, this was the only indication they had that was something that was going on unusual, is that they were just persistently hoarse. And so especially in persons who are smokers, we're very, very concerned about those persons when we notice any hoarseness that persists. Now, what about nasal and sinus cancers? Now, we have a number of number of sinuses in our face, and that helps us But if you have blockages on one side or the other, that is something to be concerned about. If you're having nosebleeds that are persisting, something to be very concerned about. If you're having facial swelling, those are areas you should think about. If you're having sinus symptoms and they are not getting better, those are some of the things you should be concerned about. Okay? Now, our salivary glands. We all know what saliva is. We all produce saliva. We have a variety of glands in our head and neck that produce saliva. So you can have a lump near the jaw, near the ear. Now, as we've talked about before, many of these structures have very, very important nerves that go through them or pass on to them. So if you have a cancer causing an enlargement of these organs, it's going to interfere with that nerve. So you may have weakness in the face, numbness in the face. And those are subtle signs, but you need to pay attention to them. Then we have the thyroid cancer, right? So yes, the thyroid is a very, very important gland, helps us significantly in our metabolism, but you can get thyroid cancers. And that will present as a swelling of the neck. Now, there's no such thing as a normal swelling of the neck. And so in Guyana, we have significant diseases of the thyroid that are non-cancerous, and rarely, but it does happen, cancers of the thyroid. So any swelling of the neck, you need to go see your doctor. You can get hoarseness because, again, this is in your neck. It is going to press on the trachea or the windpipe. It's going to press on the esophagus or how you get food. And so you have difficulty swallowing, you have hoarseness. These are all signs that you should be paying attention to and seeking the help of your doctor. Now, why are head and neck cancers something that we should be concerned about in Guyana and in our region? We have relatively high consumptions of tobacco and alcohol. And tobacco and alcohol remain the major risk factors for head and neck cancers. And as we spoke about in another episode, HPV or human papillomavirus, that is increasing in some of the throat cancers. And sadly, many patients seek care late. Late diagnosis makes it more difficult to treat, and if we are diagnosing this later, then it's a greater impact on your speech and swallowing. And so, as we've mentioned multiple times, early action will save your life. Understanding the neck. Now, we all know where our neck is, but let's talk about this from a biology standpoint. So what are the critical structures in our neck? We've got our voice box that allows us to speak. We've got the esophagus, which is essentially the pipe that takes food from the mouth into our stomach. We've got the windpipe or the trachea. That's the pipe that helps us take air and oxygen from the atmosphere into our lungs. We've got our thyroid gland, which controls a significant portion of how our body operates. And we've got major blood vessels in the neck, the nerves that help all of this to work, and our lymph nodes. And the lymph nodes are actually quite important because we have so many lymph nodes in the neck, and the lymph nodes are where cancers will spread to. And so many of us, all of us, have had a sore throat somewhere along the line, and we've felt a lump in our neck. That's a lymph node getting larger. Unfortunately, this is exactly where the cancer will move to. So if you have any lump in the neck that is there for more than 2 to 3 weeks, you need to ask your doctor to take a look at this. We have all had infections, and you get a lump and it goes away. But if it persists, then that's a bit unusual. Now, what are the common types and warning signs? We have to divide this neck into the various parts. So now we are talking about mouth cancers. So we're looking for an ulcer in the mouth that is not healing. 2 to 3 weeks later, we're still having an ulcer in the mouth. It's painful, it's bleeding, or you're having difficulty chewing. So that is cancers of the mouth. Now, when we talk about throat cancers, we're talking about symptoms such as a persistence of a sore throat. You're having difficulty swallowing. Because of unique connections between the nerves, a sore throat or throat cancers can also give you ear pain, and it can give you a lump in the neck. Now, as we mentioned earlier, human papillomavirus is a contributing factor in certain types of throat cancers. So cancers of the tonsil and throat cancers, and sadly affecting younger persons. Now, this is not one of those cancers that's linked to smokers because it occurs primarily in non-smokers. And because it's caused by human papillomavirus, as we spoke about recently, human papillomavirus vaccination exists. So if we continue to vaccinate our young children with HPV vaccines, this becomes a preventable cancer. What about the voice box? So a key warning sign, and we have had patients in Guyana we've dealt with, they get a hoarseness. It's a hoarseness that's just persisting, more than your cough and cold hoarseness. But this is a hoarseness that's persisting for weeks, especially in people who have had a history of smoking. And so those are the type of persons we want to be careful about and look out for that kind of cancer. Now, we have rarely cancers that can affect the nasal passages or the sinuses. It's very rare. But if you notice that one side of your nasal passages are blocked persistently, if you're getting nosebleeds that are not explained, if you're getting an unusual facial swelling, if your sinus symptoms are not improving, these are the kind of things that should drive you to see your doctor. As we continue to talk about other organs in the head and neck, we talk about the salivary glands. So these are the glands that help us produce saliva, which we all know helps in our digestion. So you can have a lump near the jaw or near the ear. Because the salivary glands are usually have nerves passing through them, you can get a weakness in one of these nerves, causing a facial weakness or numbness in a particular part of the face. Now, what about thyroid? The thyroid gland which sits in our neck. So that will usually present as a swelling in the front of the neck. Most people in Guyana, the reason for their thyroid swelling is not a cancer, but if you notice any swelling of the neck, you need to approach your doctor. Simple examination, simple ultrasound will help. So if you have a swelling, you have hoarseness. Now, you could have difficulty swallowing. People may say, well, why would I have difficulty swallowing? Remember, the pipe that takes food from our mouth to our esophagus passes right at the back there. So if you have an enlargement of your thyroid, it can press on that pipe. Now, the good news about thyroid cancers is that they are highly, highly treatable. And so again, as we speak about, it is very, very important to seek medical attention when you're dealing with this. Now, who's most at risk? Again, if you're over the age of 40, your risk is increased. If you're a smoker, and notice I didn't say heavy smoker, I said if you are a smoker, you're at increased risk. Heavy alcohol users, persons who have been exposed to human papillomavirus, along with those who have had a long-standing irritation of the mouth. Now, how are these cancers diagnosed? And unfortunately, as I mentioned, many of these cancers are diagnosed late. Thankfully, in medicine, we have lots of little cameras, and these cameras can be attached to rigid tubes or flexible tubes. So many times what we're going to do is your doctor will pass a small camera either through the nose, and he's looking at the back of the throat. If they see anything suspicious, they will take a biopsy, and that will go to the pathologist, and you will get diagnosis based upon that. Imaging is always there. So we will do in Guyana, we can do CT scans, which are radiation scans, similar to X-rays, but much more detailed. So we all know them as CT scans. We can do MRI scans, which are magnetic resonance, doesn't involve radiation. You will also, if you go on the internet, you will read about something called a PET scan. We don't do PET scans in Guyana, but that is a scan that is available in the wider areas, in the wider region. Human papillomavirus testing for any throat cancer, because that would change the way in which we're treating this, which leads us into the discussion about treatment. Now, treatment of all cancers sort of falls into some big buckets. There's always surgery, and surgery is aiming initially with a biopsy to make a diagnosis, and surgery is then aiming to remove the tumor. We know that the vast majority of cancers have spread, and so we tend to want to include chemotherapy for advanced disease and then radiation. So what's the difference? Chemotherapy is a chemical, it's a drug that is given to you and will travel through your entire body and look for cancer cells that have gone to other parts. Radiation is sort of an extension of the treatment in the local area. So we have target, and then we have this new area which has been around for a little bit and continues to be an exciting area, and this is immune therapy. This is where we are learning more and more about these cancers and finding specific medications that are targeting this. So we are not going to go into great detail about all of the detailed medications, but immune therapy, so surgery, radiation therapy, chemotherapy, and immune therapy. Now, what about the recovery part? Because these are very sensitive areas that are involved in our speech, involved in our swallowing, involved in nutrition, all of these aspects have to be dealt with, including dental care, because all of these treatments are going to have an impact in our speech, in our swallowing. How much are we eating? Is it painful to eat? Are we able to swallow well? And so it requires a significant amount of care. This is a significant psychological impact for most patients. And so we need to include the mental health and the supportive counseling that's necessary. Because when we are managing diseases anymore, it's not just do we want you to survive your cancer, but how are we improving the quality of your life? And so today, the vast majority of this is a multidisciplinary approach. We call on persons from the various specialties to ensure that we are providing a complete and total care. Everyone wants to know, can these cancers be cured? As it's true for all cancers, when we find them early, cure rates are very, very good. Sadly, most of us or most patients in our region will ignore these early symptoms. So I only encourage you to please go and see your doctor any chance you have or any concern you have. Now, how do you reduce your risk of head and neck cancers in particular, but cancers in general? You need to work on quitting tobacco. Now, we know that quitting tobacco is very, very difficult. It takes persons sometimes at many 10 attempts to quit tobacco. So the support is there, the options continue to increase. So please work on stopping your smoking. We need you to reduce your alcohol intake. We really, really need us to really work on reducing alcohol intake. It is really affecting us significantly, not only in cancers, but in our general health, and of course on the motor vehicle accidents we are seeing every day. HPV vaccines we have spoken about. There should be no reason why our younger generations are not getting this vaccine, and speak to your doctor, because even this vaccine is now being offered to even older persons. Good oral hygiene. You need to have your regular dental checkups. You need to be speaking to your dentist frequently so that you have a thorough examination of the oral cavity in your mouth. If you have a lump in the neck, you have an ulcer, you have hoarseness, and these things are persisting for beyond 2 to 3 weeks, that is an indication that you must seek medical advice, because that's not normal. And that might be the only indication you have that something is unusual. So, in closing, I'd like to remind everybody that head and neck cancer is serious. It is a common cancer. It is a cancer that is sadly too prevalent in our region. It is highly treatable when detected early. So please don't ignore any of the more common signs. You have a sore in the mouth that won't heal. You have persistent hoarseness. You're having difficulty swallowing. You're having a lump in the neck that's just not going away. So, as we have always said before, early action can save your life, your voice, and your family from heartbreak. On that note, we thank you for joining us for this episode of Ignite Health, and we look forward to seeing you in our next episode. Thank you very much, and on behalf of Ignite Health and Caribbean Surgery, have a wonderful day. Thank you.